Chair, the meeting is now live.
Thank you. Good afternoon and welcome to the Health and Overview Scrutiny Panel. I'm Councillor Mark Jeffrey, Chair of the Health and Overview Scrutiny Panel. Members of the public are invited to view this meeting online. Those present are requested to keep their microphones on mute and to only turn them on when you are called to speak. Members are requested to keep your cameras turned on at all times. Officers and external presenters are requested to turn your cameras on only when you are presenting your reports or answering questions. Members have read the report, so presenters please just highlight any developments that have occurred since publication. If you'd like to speak, please write your name and RTS, request to speak, in the chat function. I would now like to invite those present to introduce themselves. Okay, so shall we go around? David?
Thank you, Chairman. David Evans, District Councillor at East Hants District Council. I've been a councillor for 12 years, but never on this panel before.
Thank you.
I represent Horndean, by the way, part of the representative of Horndean.
And actually, sorry, apologies for not calling you councillor. So, Councillor Graham Heaney.
Thank you. So I'm Councillor Graham Heaney. I'm a Labour councillor for St Jude Ward. I'm also the Labour Group spokesperson on health, wellbeing and social care.
Thank you. Councillor Judith Smythe.
I'm a Labour councillor for St Jude Ward. Good deal of experience working in the NHS as well as in local government, and I'm very pleased to be here.
Thank you. Councillor Matthew Atkins.
Hello, I'm Councillor for Cosham Ward in Portsmouth and a member of the Scrutiny Panel.
Thank you. Councillor Stuart Brown.
Good afternoon, everyone. Councillor Stuart Brown, Liberal Democrat Councillor for Fratton Ward in Portsmouth.
And then shall we go to the people who are here as well? Siobhan, could you introduce yourself?
Thank you. Siobhan McCurrick, Health Watch Area Director for Portsmouth and Health Watch Hampshire.
Thank you. Andy Biddle, please.
Thank you, Chair. Good afternoon all. Andy Biddle, Director of Adult Social Care at Portsmouth City Council.
And Nikki Crichton-Young, please.
Thank you, Chair. Good afternoon. I'm Nikki Crichton-Young and I'm the Director of Operations from Southern Health NHS Foundation Trust.
Thank you. And Mark Orchard, please. Mark, I think you weren't unmute, so you.
Oh, I'm sorry. Yes, that is the first time I've done that today. I do apologise. Good afternoon. I'm Mark Orchard. I'm the Group Chief Financial Officer and Deputy Chief Executive for Portsmouth Hospitals and also the Isle of Wight NHS Trust. Thank you.
And then, does everyone know Lisa Gallagher from Democratic Services from Portsmouth? I'll take that as a yes.
Hello.
Okay, thank you. I think that's everyone on the call at the moment, isn't it? Okay, so I'm just going to take apologies. I've got apologies from Councillor Richardson and Councillor Atwell. And I know that Councillor Julie Richardson has declined. She's not able to attend the meeting, so we'll take her apologies as well. Are there any other apologies?
I'm not aware of any, Chair.
Sorry, I actually got that wrong. It's Councillor Anne Briggs who isn't able to come to the meeting, so we'll take that as apologies as well. So we've got Councillor Richardson, Councillor Atwell, and Councillor Anne Briggs for apologies. So moving on next to declarations of interest. Has anyone got any declarations of interest? No, can't see anyone there. Okay, thank you very much. Okay, so let's go on then. So minutes of the previous meeting. Should we go through them for the page? So is there anything on page 3? Page 4? Page 5? Page 6? Page 7, page 8, page 9, and page 10. Okay, thank you. So the next agenda item is the stroke recovery service. So over to Andy Biddle, Director of Adult Social Care. And Andy, do you want to take the screen?
Thank you, Chair. Yes, certainly will. So the report's in front of you, and the purpose of the report was to provide an update following the decision to withdraw from recommissioning the Stroke Information and Support Service, which is commonly known as the Stroke Recovery Service. The information in 3.1 is the background to the service, the original contract, and the progress over the years with that contract. Then at 3.2, the rationale for withdrawal from the contract, the last part of that paragraph, due to the pressures on the adults care and support budget in Portsmouth, there was currently no funding identified to support the outstanding balance of what the contract would cost during 23-24, which was 60,834. Moving through into section 3.3 on the second page of the report, we've listed some information there about what the contract provides for, what the service provides for, and some of the basic statistics around referrals. So the kind of things that people were referring for, from which agency they were referring from, and the outcomes of those referrals. Then under 3.4, we've outlined the National Stroke Service Model that was published by NHS England, with a recommendation that all ICBs put in place a National Stroke Service Model. And moving on to that next page, suggested that could include working with the voluntary sector in that model to support the stroke recovery service. And then for the rest of that page, I've talked about the other resources that are available to Portsmouth residents who have experienced a stroke. And those mainly are funded either through the NHS or through local voluntary and community groups. To apologise in advance, I'll share an office, so you will occasionally get my colleague who's also on a Teams call coming over on my speaker, so apologies about that. Then moving on to the next page, we understand that the ICB, Hampshire and Isle of Wight ICB, does not have any current plans to commission a specific life after stroke provision from the voluntary sector, and highlighting that the provision of a stroke recovery service is not a statutory responsibility of the local authority, and has previously been provided by us under discretionary powers rather than statutory obligation. Finally, in the summary under point 4, certainly no question of the quality of the service that's been provided to the residents of Portsmouth, but acknowledging that the Adult Social Care and the City Council needs to focus on its ability to discharge its statutory duties, which influences some of those discretionary services that have been provided to this point. And then finally, under point 5, the update for this month, that as of September, with the awareness of the association would need to begin processes to close the service because we had an extension in place until the end of December of this calendar year. The leader of the council and the cabinet member confirmed for Health and Care, confirmed to the Stroke Association that the council had identified further non-recurrent funds to maintain the service until the end of December 2024. The rationale for that is that the council has extended that with the expectation that the ICB will implement an ICSS model in Hampshire and in the Isle of Wight during 2024, although there's no expectation at this current time that the ICB would commission from the Stroke Association in the same way. Hopefully that's a summary of the key points that I picked out of the report, and of course happy to take any questions, comments. Thank you.
Thank you for your report, Andy. Before we take questions, I just wanted to ask Councillor Pepper to introduce himself. He's joined the meeting.
Yeah, thank you, Chair. Martin Pepper, Gosport Borough Council, having all sorts of problems with IT this afternoon, apparently. I'm working from my laptop. My computer's gone completely bonkers. Apologies. And so has my sound. Oh, that's... Hello?
You okay?
I think you want.
Hello. We heard you.
Oh, great. Thank you.
Okay, and Daniel Clark has joined the meeting.
Hello, yeah.
Okay, so are there any questions for Andy Biddle? Councillor Graham Heaney.
I did put it into RTS, but I'm not sure whether we're waiting out and doing way or whether we're doing RTS. Anyway, I do have some questions. First of all, I'd like to say I'm very pleased that the council has agreed an extension to the funding, because this is an issue that I've been involved with my colleague Councillor Gerarda and with the people who use the stroke service as well. So I'm very pleased with that. I was just slightly, first question is slightly curious to why December and not the end of the financial year, which I would have thought have been a more logical point at which to say that's when funding would end and then any potential new decision would be made. Is there any reason why December and not the following sort of March, April? Because it seems to me that we're potentially, well, I'll come on to that in a minute, but just why December, not the end of the financial year? It's sort of partway through the financial year.
I can't really give you a detailed comment on that, Councillor Healy. My understanding was that that's the sum of money that had been identified, because this is coming from council funds rather than through the adult social care budget. So I'm guessing it's due to that, but I can certainly follow up on that and come back with a more detailed answer for you.
Okay, that's useful. Just to follow up then, I mean, the report doesn't suggest that the ICB is looking at developing an integrated community stroke service as according to the framework which is in the NHS long-term plan. I was looking at the end of paragraph 3 on page 14, where it says all ICBs are responsible for delivering against the ICS within the terms of the NHS long-term plan. Current statutory obligations are being met for the services that have already been commissioned. Now that seems to me to suggest that they're not going to. I know Councillor Whittington has been in contact with me and he thinks that they are going to consider this. And I think this is the next element of it really, because we need some clarity about what the ICB is going to do. Are they going to develop a integrated community stroke service? Are they going to review what they're doing at the moment? I understand obviously they're in fairly difficult financial circumstances, but we don't have any clarity about that. And I wondered if we can have some clarity, because what I'm worried about is that we'll come to this time next year, 3 months before the contract ends, and we're in exactly the same position as we were back earlier this year, where nobody's got any money to fund it, the ICB haven't done anything, and we'll be back into another crisis situation.
I think so. My understanding is that a letter was sent to the ICB by Councillors Willington and Pitt, but we hadn't had any response at the time of writing my report. The question that had been asked was around the integrated community stroke service, and in terms of whether there would be some temporary funding for this service if that wasn't in place. Now, my understanding is we haven't had a response from the ICB formally as it stands at this moment in time. So the administration's expectation, as it's been communicated to me, is that the ICB will put in place a model, but not necessarily that would include this current service. There isn't necessarily a clear obligation on the type of services put in place. I think the point about working with the voluntary and community sector is an advisory from NHS England, but I'm not sure that that's an obligation. So I don't know that we can give you any further reassurance on that without that response from the ICB as to what their plans are. But when we have that response, I'm imagining that will be shared. Sorry, that doesn't really answer your question fully.
No, I understand. Obviously, you haven't heard from them, so you can't say it. I have looked at the Health and Wellbeing Board, and there is apparently going to be a verbal update next week. Unfortunately, my new teaching timetable means I'm lecturing at 10 to 11 on that day, so I won't be able to attend. So I won't be able to hear the verbal update. I don't know if anyone from the NHS knows what the verbal update is going to be. A bit of a preview, maybe. I don't know whether I'll be allowed to do that. But I'll obviously try and pick up from that. So the other thing about if you're going to look at stroke services is that there would presumably need to be some sort of plan and public consultation, and that takes time to organise. So I'm just hoping we'll get a response back from the ICB as soon as possible about what their intentions are. And I suppose at this point we can't really say any more, but that's my sort of where I'm looking to for them to act. And to be honest, if they are going to develop this, I think it would be appropriate for the health committee to be part of overseeing that process and seeing what changes might be made and so on. I mean, the Stroke Association has spoken to me on a number of occasions, and they're happy to think about different provision. They're not wedded to only doing the same thing they're doing now. They are quite happy to change and fit in with wider strategic plans. But my point about this service is that it's been running for about 14 years. I'm correct in saying, and no one is saying this service is either not needed or not very good. So the question has to be, why are we getting rid of it? And that's really where my point is. But I'll stop there because I think I'll leave it there. Thanks. Hi, Mark, you're on mute.
Had to happen. Thank you. I thanked you for your questions, and I asked whether Councillor David Evans, I think, has indicated he would like to ask a question or two.
Thank you very much, Chairman. I've got a lot to learn about all this, so please bear with me. I noticed on page 3 it lists a load, Think Ahead Stroke, National Stroke Association, etc. Lots of voluntary organisations offering similar services, and this is what you see, I think, right across local government and the voluntary sector. There are lots of voluntary organisations overlapping and providing the very, very similar, or if not identical, services. And this is a very large sum of money that is being paid for this. And I come down to the top of page, first paragraph from page 4. I don't doubt that I wouldn't choose to comment on the quality of the service they provide, but it does say that first paragraph, this was deemed an expensive service, supported a small number of people. Now that says to me it's a sum of money that's not being as well spent as perhaps it should be. So is that situation something that has occurred recently, or has it always been an expensive service that supported a small number of people? I might have to come back on that if you got an answer to that, please.
Thank you, Councillor. So it's slightly confusing. So on that first paragraph, where we've said that the ICB doesn't have any current plans to commission a specific life after stroke provision, that next part of that sentence talked about a service that they didn't recommission in 21-22. So that was a different service called the Stroke Communication Support Service, and it was put there really to indicate that whilst we don't know whether the ICB plans to commission a specific life after stroke provision, the indication would be that they may not, given that they decommissioned that other service, and it's that other service that was deemed as expensive and supporting a small number of people, just for clarity.
I'm not entirely sure that answers my question, because probably resulting from my ignorance of the subject. But my concern is that whatever we spend needs to deliver the maximum return for the customers. And so I'll leave it at that. I'll continue learning. Thank you very much, and thank you, Chairman.
You're on mute again, Mark.
Yeah, I know. Thank you, Councillor Owens. Councillor Graham-Heaney, please.
Just to come back on that briefly. I mean, I am also aware that the need to make sure that health money is spent as effectively as possible. But also, I mean, I've had previous experience of being a non-executive of a trust. I've sat on Health and Scrutiny Committee. I've also been involved with Health Watch. I also think our role is in part to challenge and question what is being said. And I know, for example, because I've followed up, is that the service ended up being funded via underspend some other budgets, which is not a good way forward. And to be quite honest, the ending of the process of that contract was, to say the least, a little chaotic. And I have my concerns about the way the voluntary sector is treated generally in the way we commission services, and I'm not sure it was the best example of how we could have treated it. So it's a question of challenge, really, and I want to be clear that that a valued service is not just removed just because someone has got some budgetary issues, which can be addressed elsewhere.
Thank you for your comment, Councillor Heaney. Okay, so any more questions on this one, please? No, I think that's no. So thank you, Andy Biddle. All the report has been noted, and we'll go on to agenda item 5 now. So,
sorry, Chair, to interrupt. I think Councillor Smythe was indicating.
Oh, sorry, Councillor Smythe.
Thank you. Do we have any idea, this is a question for Andy Biddle really, but also I suppose for ICBs, this does seem to be not a very good example of commissioning or decommissioning. And have we any idea whether the deadlines for resolving this situation, and would it be something, Chair, that we should bring back to HOSP next time to see what progress there's been?
Thank you, Councillor Smythe. Andy Biddle?
So we don't have any idea at the moment, Councillor. So as I've said in the report, we haven't had contact from the ICB, so a letter was sent to the ICB by the Leader of the Council and the Cabinet Member of Health and Wellbeing, and there hasn't been a response to that as yet. So no, we don't have any definitive timeline as it is. I'll defer the question on HOSP to the Chair.
Yeah, we can bring that back. So, Councillor Smythe, I think you're on mute.
I think we should at least bring it back as a kind of flagged matter arising, because I would certainly like to know how this story unfolds, and I don't want us to be left, and clients in the community be left cliffhanging at the end of this, because it's very bad practice for them and their carers, and just generally for Portsmouth's reputation as a commissioner.
Thank you. Andy Biddle, would it be appropriate for us to ask the ICB to come to this next meeting and give us an answer?
I think you could. I also note that my colleague Jo York has joined the meeting, and she may wish to also comment if you'd like to invite her, Chair.
Okay, so thank you. Hello, Jo. You've just joined the meeting. Do you want to introduce yourself? And I think you're on mute.
Apologies. I'm Jo York, Portsmouth, Health and Care Portsmouth Place Director for the ICB and the City Council. I think can only apologise to Portsmouth City Council. The letter, I think, that Andy refers to came in whilst I was on leave over the summer. I think we had thought it had been, because it was addressed to the Chief Executive, I believe, and we had thought it had been responded to. That doesn't seem to have been sent, so I do apologise for that, and that will be happening in the next day or so. I think obviously myself and Andy work really closely on this, and the team that reviewed this service are a shared team between the local Health and Care Portsmouth team and the council. We are still and support the decision that, we clearly support the decision that the local authority have made. We are working through the implications of the new stroke pathway, but it is, and again, that review has happened, and as the extension has happened, we will continue, but it is challenging to understand what this service provides that isn't already in place through other mechanisms. So that's what we will need to test, I think, over the coming months. But really happy to come back and we'll respond immediately to the letter and apologies that we haven't, and really happy to come back with an update at the next meeting.
Great, thank you, Jo. Are there any more questions at all, please? I think that's a no. So thank you very much, and thank you, Andy. Your report's noted. So agenda item 5. Mark Orchard.
Thank you, Councillor Jeffrey, and I'll I heard what you said earlier on, that assume that everyone's read the report, so I'll just pick out a few things if I can, with slight updates where appropriate, but I'll keep it as brief as I can, and then obviously time for any questions or comments. So you've got a briefing paper there in the usual way. A few things I'll draw out. So first of all, at the top of the paper, you'll see we're referring to our partnership developing, so talk about Portsmouth Hospitals NHS Trust partnership developing with the Isle of Wight Trust as part of our acute partnership. That has certainly developed to the next stage now, in that we've got now, as you'll see in the paper, a joint leadership team in place. So I introduced myself earlier on in the way that I did. So I've been at Portsmouth for just over 4 years, and my role has just effectively been extended in the group model with the Isle of Wight Trust and the wider leadership teams in place. But it's not about sort of leadership change. This is about supporting the Isle of Wight Trust and supporting the population that we serve across both sides of the water. And so there's much more work to be done now to work through the clinical and financial sustainability benefits that we can bring for the island population, but also to the populations of Portsmouth and, of course, South East Hampshire as well. So much more work to be done on that. What I would just say, though, just to sort of, if there are any anxieties around this, there is nothing from a service change perspective we're expecting to see in terms of Portsmouth particularly, and we remain two separate statutory bodies. So this is really about the Portsmouth as the mainland larger organisation effectively leaning in and supporting our island colleagues, particularly where they're unable to recruit to certain services and maintain certain clinical standards, or at risk of maintaining clinical standards as a result of the challenge that short stretch of water brings. So happy to say some more about that, but that's really just to and more of that as that develops, but we remain two statutory bodies. Clearly, it's a very small part of the report, but actually clearly the main focus today is industrial action, and everyone will know on the call, and you've seen in the media, and you're certainly aware that we're facing the first period at which we've got both groups of junior doctors and also consultants out on industrial action. Relatively small numbers for the Trust for Portsmouth, but that said, though, the combination of the two groups being out causes additional challenges. So we are under pressure today, and have been yesterday also, and expect to be for the remainder of the week. So we're not in major incident or critical incident, but we are managing we are having to manage safety on an ongoing basis really carefully in terms of the services we're providing. And you'll see how we've messaged in the media that we are very much open for those that need urgent emergency care services. Of course we are, but we have had to stand down some of our planned elective care as we would do on a Christmas Day service, and that's effectively the language that's being used. So we're coping as well as we can do at the moment, but of course that's a live position. There's then some commentary in the report around the developments on the Portsmouth, on the Queen Alexander site, and so you will know we're currently just over a year away from opening the doors to our new emergency department. We're all really excited about that, and this group has really supported the progression of that all the way through, so thank you for that. We're a few weeks ahead of our construction programme, which is brilliant. We've got another winter to go through, though, and so that could bring a challenge, but at the moment we're in the right place. And we're now, and a few colleagues and I have just come from a session just before this, actually, where we're starting to plan now for what the operationalisation of that new emergency department looks like in just over a year's time, and how we really get the benefits of just not moving into a new building, but actually get the benefits for the site. And as you know, that's a footprint. The estate footprint effectively doubles the size of the footprint that we've currently got for emergency services or the emergency department, and also brings co-location of other services you'd ordinarily expect, which are not co-located in the current department. They're elsewhere in the hospital. Those of you that have been on site Queen Alexander Hospital recently will also know that we've got other developments happening right now also, including the expansion of our main entrance, and soon we'll be moving on to the north entrance. But that's probably of a different scale of reason, and again, come on to some of that if it's helpful. There's a whole section in the report around engagement. I'll just take that as read. So there's two things I was just going to mention, and they're kind of related, really. They're not in the report, but perhaps I just wanted to give a nod to. So first of all, our winter plan. So we've got a really clear winter plan for Portsmouth hospitals. It will be a challenge plan because obviously winter will challenge the organisation, particularly our emergency services, obviously greater than even we're experiencing now, and we've seen that pressure all through the summer, and that hasn't gone away. We had usefully, and there's a few colleagues on the call today that were part of this yesterday, Nikki and Joe particularly. Yesterday we had a system-wide, Portsmouth and South East Hampshire system-wide sort of sharing and learning around our individual statutory organisations' winter plans for the health sector. So we had that sort of first session yesterday. And I suppose I would say there is more to do to make sure we've got fully joined up winter plans, but that is certainly where the focus is at the moment. So you'll see the Portsmouth Hospitals University Trust's winter plan in the public board session next week. For those of you that are interested, I'm happy to share that in the meantime. That's going to public session next Wednesday. Other statutory bodies around us, many of which are represented on this call, are also at varying degrees of readiness for their own winter planning. And what we're doing now is trying to join that up, and that brings on to the last thing I was going to mention, which is absolutely related, which is COVID. Obviously, whilst we're in a post-COVID environment now, of course, in our individual lives and also our working lives, COVID very much remains with us, and so we are seeing both in terms of our staff, but also patients that are presenting to the hospital, we are seeing over the last few weeks an increasing prevalence of COVID-related sickness or COVID. Now, of course, we're not measuring that or capturing it in the way that we once did, so it's not comparable with the pandemic, because obviously we're not routinely testing across the board in the way that we were, so it's just not comparable. But what we are seeing is our sickness absence rate, even in the last few days and week, increasing quite markedly around COVID. So we've already started our COVID vaccination campaign for staff at the Queen Alexandra site, and that's going well. Our flu campaign starts shortly also, but I just wanted to mention that as well. I will pause there, Councillor Jeffrey. Happy to take any comments or questions.
Thank you, Mark. So it's over to members for questions. So I've got Councillor Graham Heaney, please.
Thank you, Mark, and thank you, Mark, for your report. I just wanted to ask a question about an item on page 18 about the leadership team, and obviously people going into the group executive. And you talk about the need to consider options for backfilling. I mean, is this going to be a challenge financially, i.e. because you need new people, or are you just going to expect other people to sort of act up, if you like, in terms of the role? So is it going to be a challenge there, or do you have the financial ability to employ extra people if you need to?
So that's a really good question, and there's two things going on. One of which is described in the paper, which is really a question, and then the other one, which is related, which is important to mention in the same context. So I'll mention the other one first, and hopefully it helps you answer your question directly. As we work together with the Isle of Wight Trust, what we're really clear on, and the Isle of Wight Trust are really clear on also, is it gives us the opportunity to relook at the non-clinical corporate services that service the two statutory bodies, and to get much more efficiencies. It won't be overnight, but it'll be over time, through natural attrition largely. And we're working on those plans at the moment around how we get scale benefits through our back offices in effect. That is very significant to both trusts in terms of our ongoing savings plans going forward, which means that we can protect frontline services, particularly clinical and clinical support services. Which then leads me on to answer the question, I suppose. So yes, we are in having a group model over the two statutory bodies. In isolation, that brings some additional cost. We've limited that. We've not recruited outside the organisation. We've filled those posts with people that are already in the two organisations, and we're now working through. We've got the next stage to work through around how we fill and make sure we've got the leadership teams to support. So in my case, for example, I'm very much still the Chief Financial Officer of Portsmouth Trust, as well as being effectively the same role across the group. So we haven't backfilled. We're going through a process. We're not expecting a recruitment campaign or adding a significant extra cost. In fact, as I say, which is why I mentioned the wider piece, we expect overall to take actually a disproportionate level of recurrent savings over time that allow us to make better decisions for our clinical services that support our populations. So hopefully that, I'm happy to elaborate on that, Councillor Heaney, if you wish. But that is, that's kind of the plan.
Yeah, I obviously don't expect you to go into massive detail about.
Oh, you've just muted yourself.
Yeah, I get the picture of what you're saying, so I understand. Yeah, I just wanted a little bit more of what was actually going on. That's been really helpful, so thank you for that.
Thank you. Okay, I've got Councillor David Evans next, please.
Thank you very much, Chairman. I was going to ask, first of all, the question that Councillor Heaney just asked about backfilling. But so I am going to come on to the answer, which is you're going to, you've recruited backfilling places from inside the organisation. Well, that means something else has got to be backfilled, and it ripples through the organisation. At the end of the day, you're going to employ a larger number of senior managers than you did before, are you not?
No, and thank you, and I understand that, and apologies, we're in that stage at the moment where we're not able to maybe perfectly describe this in the numbers, but actually no, we've got a genuine ambition and outline plans that we're working on at the moment with the Isle of Wight Trust to reduce the back office administration costs of the running of the two organisations. So we're not backfilling every role, and otherwise you'd end up in exactly the same place that you just described, Councillor Evans. That's not where we're at. So we're looking at reshaping roles, reshaping how we and this is avoiding the duplication, where we will be able to avoid backfilling every role. And so give you examples, for example, well, there are all sorts of examples on there, but but one of the ways we'll do that is we're currently working through how we have identical systems and processes for our non-clinical work particularly, which means that we haven't got a duplicate. So we haven't got a person on the Isle of Wight and a person on Portsmouth managing our payroll system or something, for example. So we end up in a position where we've got a more efficient resource managing the two, but you can only do that if you have identical common systems and processes, and that's the bit that we need to get to next. We're at a pause moment at the minute because we're not backfilling the post. So take me as an example, happy to personalise this, there are others, but we're not backfilling myself and others right now at this moment. We are taking a pause moment to see what do we need so that we don't end up in the position that you've described, which would be a risk that which we will avoid.
Okay, thank you. The other part of my question was going to be, the paper doesn't explain to me, and I guess it's already known, but it doesn't explain to me particularly why it's needed to create this group. Is it that there is something that economies of scale or whatever to do with the Isle of Wight Trust that needs to join with the Portsmouth Trust in order to be more efficient or provide a better service or whatever? What's in a single sentence? What's the rationale? What's the reason for it?
Okay, a single sentence is hard, Councillor Evans. I'll do my best to not have too many sentences. The Isle of Wight Trust is already a very small trust compared to an average trust on the mainland. Portsmouth, for example, our turnover is £800 million per year. The Isle of Wight Trust currently is about 300 million, so a lot smaller. Come April, this is wider, come April, the Portsmouth Trust will be even smaller. It'll be less than 200 million turnover, because community and mental health services are transferring to a mainland provider. They're transferring. So what you're left with then is a very, very small scale district general hospital that though, because of the water, has to provide 24/7 emergency services and maternity services for the population. Otherwise, it'd be just too long to get to the mainland. For that reason, it's subscale, and therefore Portsmouth has, for many years now, worked as an increasing partnership with the Isle of Wight. Now, what we're not doing is merging the two organisations, because the Isle of Wight have got the unique challenges for clinical and financial sustainability. So this is how we're planning on managing that for the time being, but that hopefully gives a bit of a sense around how we're hoping to support our island partners.
Could I just double check? I'm sure it was just a slip, but you I think you said Portsmouth will be getting smaller by 200 million. You meant I'm right.
Yeah. Sorry.
Just for the record. Yeah. Thank you.
Thank you so much.
Councillor David Evans, did you want any other question to come back on?
No, sorry, that's fine. Thank you.
Thank you very much. Councillor Judith Smythe, please.
Thank you, Chair. I've lived long enough and been Health Commissioner for the South East Hampshire before it merged with the Isle of Wight to know that the Isle of Wight is expensive. You rightly said that you think clinical budgets will be ring-fenced. As now a representative of Portsmouth City Council, I'm very worried that resources that should be going to people in Portsmouth, and we still have a good deal of need here because we're a very challenged poor population in relation to the rest of the areas you serve. We won't be losing resources to the Isle of Wight. Many of the resources are to do with very fluctuating A&E demand because of the number of tourists that go, the difficulty of transport to the mainland, the difficulty of recruiting people, and you know all that stuff as well as I do. But can you reassure me that people on the mainland won't suffer through this in the long term or the short, especially as they're retaining their own governance, their own board, which take a good deal of resources, and per person their board is much more expensive than yours because of the percentage of the overall resource it takes, particularly now you're losing mental health. You get the gist of what I'm worried about. If you could reassure me, I'd be very grateful.
Yeah, no, thank you. And of course, all I can do is reassure on this call without the evidence of that. But I would say that the Portsmouth Hospitals Board, which has got its own separate set of non-executive directors, of course, has been really clear all the way through this that we're not going to do anything that's to the detriment of the services that are provided by Portsmouth Hospitals Trust. So, and that's that's been the parameters of which we put around this group partnership arrangement. That said, we are absolutely committed to working with our island colleagues. So I wouldn't use the ring fence word that you said. I don't think anything's ring fence because all services, community mental health across the country, everything is needing to make efficiencies post-COVID because we're not as productive as we were pre-COVID, and that's kind of a fact. But what we're certainly doing in our instance is trying to ensure that we the vast majority of cash savings come from non-clinical settings, and this gives us that opportunity for Portsmouth also, in order to therefore make sure that the amount of funding that the Commissioner gives us for clinical services goes as far as we possibly can do. And so I think what I'm trying to do is reassure you, Councillor Smythe, but as you know, I recognise. I recognise you'll be the judge of that, as it were.
With my history as a health commissioner and indeed working for one of the other trusts as a non-executive, I think we've got to be very careful about this. Bigger isn't always cheaper, especially when you've got a large body of water in between, and especially where you have the need to use air ambulances and other things for a relatively small population. So I think we owe it to patients and citizens in Portsmouth and indeed Fareham, Gosport and so forth to really keep this under examination. Islands are notoriously expensive, particularly when it comes to the provision of A&E and the inevitable intensive care units that you need to have behind a proper A&E. So I'm a bit worried about this, and I would also be worried if I was on the Isle of Wight. But as you might expect, you haven't completely reassured me. We've got a very long memory in this whole thing, and I think as a HOSP, working between the authorities in South East Hampshire, we need to keep an eye on this sort of thing and perhaps have a detailed report at some stage about the very general things that your report covers.
Just before we go to, thank you, Councillor Smythe. Just before we go to Mark, I've got sort of a supplementary, in effect, to that question. What measures are the Portsmouth Board going to be looking at to ensure that our citizens aren't going to be worse off? Are you able to tell us at all?
Yeah, I am absolutely certainly. So the measures are exactly the same measures that we've gotten right now, which hopefully reassures Councillor Smythe, because those are the same measures and clinical standards and access and service experience standards that are largely national standards but are built into our contract with our commissioners are identical, and therefore that's what we'll be measured on, and that's what we'll demonstrate to Councillor Smythe and others that whether anything's changed or not, I guess. So hopefully that is reassuring. And the reason I put my hand back up just for Councillor Smythe was just say that what is recognised and has been recognised for many years, and therefore what Councillor Smythe's comments are helpful in this context, is that it does cost more to run an island. There is something that's referred to as a structural deficit, but it's ultimately the additional premium costs that comes from running an island services. It's approximately been quantified externally and validated, recognised by the regulators, as about £20 million per annum. Now that's not currently funded by anyone. Our commissioners are not funded for that either, but there's an ongoing conversation around how that doesn't get forgotten and actually gets funded over time, and that's a conversation that our commissioners and ourselves are having on an ongoing basis with our regulators. And that was also a condition of our board at Portsmouth, but also the Isle of Wight board that doesn't get forgotten, so that nobody assumes that Portsmouth across the other side of the water can solve that structural premium cost, because you can't, because it's by definition of running those 24/7 services on an island uniquely, which doesn't change. So thank you, really helpful comments.
Thank you. Members, are there any more
and of
questions?
course, just to say, of course, it used to be a very elderly population. It isn't quite so skewed that way as it used to be, I understand, but I mean, it still is. Older people use more services, and so on and so forth. And also there is a difficulty of recruiting really good experts in some of these things for an island, and a need possibly to think about recruiting people who are dual skilled, rather than just the conventional teams in a conventional hospital, particularly now you've lost community services. That's just a little bit more to add to the fact that this is a difficult thing, and I hope very much you can pull it off. But the question why, asked by David Evans, was relevant and is in my mind too. Thank you.
Thank you, Councillor Smythe. Are there any other questions, members? No? Okay, so we'll go. Thank you. We've noted your report, Mark. We'll go on to agenda item 6, which is Health Watch Portsmouth. So we've got Siobhan McCurrock. Siobhan, could you give us a brief summary of your report, and then members will ask questions? Thank you.
Yes, lovely, thank you. So Health Watch Portsmouth were invited to provide a review of what we did in the year April 2022 through to March 2023. We have published an annual report on that period, which is appearing on our website. We had a board meeting in June, and I profiled in the June meeting some highlights, of which I brought along today, and it's been included in the reports pack. A few things I just wanted to highlight from that. There are 8 statutory functions for a Health Watch, and those are listed, but basically it's encouraging people to have their say, scrutinise the quality of services, encourage people to provide feedback on service experience, health and social care, and for Health Watch to be the voice of patients in conversations with regard to commissioning and provision of services. And we encourage the general best practice of engagement by partners across Portsmouth. So the end of the pandemic meant that we were able to go out to speak to people at stalls and talks and things like that. One of the figures in the presentation, 768 local people, has been trumped by the final count figure, which was 832 people that we actually physically spoke to at stalls in the 12-month period. And it's encouraging that people seek us out when we are at events and we go and talk to people. We have a 5-question document that we go and ask people what are their main concerns: health care, social care, access to, and majority of people are saying access to primary care appointments and dentistry in the city are their biggest concerns. So what we do is a breadth of activity, and this is based on feedback from stakeholders, the public, patients, and one of those was looking at the quality of information on GP surgery websites. We had some findings. We sent those to what was the CCG until July 22, and we were trying to work with the surgeries to upgrade some of that information and or remove items that were incorrect. We are just about to go out again to look at GP surgery websites. Obviously there are fewer GP surgeries than the last time we did the review, but this time we are using the government guidelines that were issued in 2022 on the basis of what should be included on a GP surgery website, bearing in mind that this is the main way in which patients are finding out information these days about their GP surgery. So those report findings will be published, and we hope that we'll be able to say how pleased we were to see what information is available easily on the homepage, pretty much. But we also worried that there may still be GP surgeries who are asking for proof of address in terms of patient registration, because this is not a requirement, but GP surgeries are still insisting that patients who wish to register need to be able to provide a personal ID, which includes an address, and this is not a requirement of the NHS. And we feel that that is unfair from GP surgeries to impose that. So that's just been a campaign that's been going on and on and on. We also are going to be looking further at delays to elective care. And even today, I was up at Portsmouth Hospitals University Trust. I was speaking to the chief nurse, Liz Ricks, asking about what information is provided to patients whilst they're on those very long waits. And we're going to receive a copy of the template that PHUT send to patients, as well as any online information they provide, to see what quality of information patients are getting to help them look after themselves whilst they wait for their elective care. So we had, going through the report, we've made a difference in various places. Patient voice was magnified in the Hampshire and Isle of Wight Integrated Care Interim Strategy. Obviously this is a living document and they continually review it, but there was, from the intervention of Healthwatch Portsmouth, there was a greater inclusion in that strategy document of the patient voice, and it's none so more relevant now in relation to Martha's Rule in terms of the opportunities for patients to feel they have a legitimate right to have their say and question when they feel that there are things don't feel right about their relative or loved one in terms of the care. So we have been working closely with the Hampshire and Isle of Wight Integrated Care Board, and particularly in Portsmouth. And there was a big piece of work we were involved with regard to the closure of North Harbour GP surgery. And we are now looking at the longer term outcomes from that, mostly the impact on patients of being transferred from North Harbour to perhaps Portsdown practice or Drayton, and the greater difficulty patients are having in accessing the surgeries that they've been registered with. We are working quite hard to see what can be done to improve access. One of the things I've been calling for is an analysis of the cloud-based telephony that those surgeries have to see what is the unmet need from calls being dropped or abandoned from patients not being able to reach the surgery. It's an important distinction, the demand and the unmet demand, and that is something Healthwatch Portsmouth will be continuing with. So we've got a bladder and bowel service, improved information, and as was discussed earlier, the quality of information for patients is crucial to help them make good decisions about the health that they seek and the services that they use. So it's always good when we get a good outcome. So over the current year, we are looking at the mental health service, huge review across Hampshire and Isle of Wight, and encouraging best practice engagement. We did highlight the lack of patient and public engagement in the independent review in the first stage of looking at mental health and community and learning disability. And we highlighted the fact that there was scarce evidence, excuse me, of engagement with the patient voice to form that initial view of what the recommendations should have been. Excuse me. Sorry, one moment. I've been talking all day and I've finally hit my limit.
Are you okay? Are you okay? Or do you want to?
No, it should be okay, thank you.
Okay.
So yes, there is still a lot of work being done on that mental health, community and learning disability review. we attend meetings that Solent NHS Trust host with the community to look at what are the efforts being made to engage with the community, and how are people's views, wishes, fears being addressed with the planning for the new trust that is merging, obviously, for mental health trusts. We do find that with best practice, you can save an awful lot of time and effort if you ask patients in advance of your putting together plans. It is amazing what great ideas patients have that can prevent services from then having to review things when they haven't seemed to work very well in implementation. So we have a great concern about health inequalities in the city, and there is a project we are running at the moment with the University of Portsmouth to look at those barriers that people are facing in the city, particularly in the most deprived wards, and we will be putting a report together and publishing that and presenting to the Health and Wellbeing Board in April or May, whenever appropriate for that meeting. So I also had another document, but I'm conscious of time and whether people want to ask questions rather than me continuing with any more commentary.
Thank you, Sean. Members, do you have any questions, please? Councillor Graham Heaney?
Yes, thank you, Siobhan. Thank you for the report. And it's amazing the amount of work you managed to get through given the limited resources you have. As I say, having been involved with Health Watch, I sort of got a bit of an understanding about it. So
yes.
Congratulations and well done. I'm inevitably going to ask a question about item on page 33, where you did a mystery shopping exercise for support for stroke patients. Do you have the details of that available for someone to have a look at? Because
possibly still.
I had a quick look on the website. I couldn't see it, so maybe I was looking in the wrong place. But I would certainly be interested to know what you got out of that. Obviously,
okay.
With the current issues going around stroke services, I'd really be interested to know if you're.
Yes, sure. Off the top of my head, so it was only a small mystery shopping exercise, but it was still valid, because we just phoned up the ward to see what was available for patients who were in the care of PHUT and would be then looking for aftercare, and very little referral on to the stroke recovery service. So we were concerned that the services in the community were not being used as well as they could be, due to clinicians not either knowing or B, referring on signposting. So that was the main concern that we had, and we fed this back to the stroke recovery service.
And in relation to the argument that there are plenty of services available for you to use, is whether they were being used or being referred to. Anyway, I'll come back to you on that if you can.
That's
come back
right.
To me with the details.
It's very dependent on clinical knowledge of what is available in the community, and I think it's often a mismatch between what's offered, what's available, and who's telling people about it.
Thank you. Any more questions, Councillor Heaney? No. Okay. Councillor David Evans, are you putting your hand up? Yes, you are.
I did. Thank you, Chairman. Sorry. This is something that you might be able to pick up. I was very impressed with what you've been saying about talking to customers, because the health service is an immense business that is extremely intimidating to try to deal with, and unless you're well educated and so on, and I mean very well educated. I don't just mean you've been to school. Now, this is something that I experienced. I have, a few years ago, I came down with a chronic condition, and I have to go to QA for an infusion every 8 weeks. I now do that at home, but nevertheless, over a couple of occasions, I walked into the north entrance, and on one of those big poster signs that stood outside, it said, "Have you made a will?" Now, I wrote to whoever put it up, I can't remember who it was, and they said, "Oh, well, we put that up in order to try and get donations." But they didn't get the point. They obviously didn't get the point. If you're walking into into QA, lots of people are very nervous about what they're about to be done, what's about to happen to them. Are they going to survive, and what they're going to experience in the hospital, and to be confronted with, before you come into the hospital to have your operation, have you made a will? That really is crass in my view, and I wouldn't like to see it. I'd like to see it sort of ended. Thank you.
So yes, I understand that sometimes communication issues, there are unintended consequences, are there not, from decisions made. I'll let Portsmouth Hospitals University Trust respond directly to that, but we had also an issue with a campaign in the winter where there was a emergency department member of staff talking about their Christmas wish, and we recommended to the comms and engagement team that the poster campaign was not used because it was giving the wrong message to patients. From the patient perspective, it was viewed in a different way to the way the trust was intending. And I think this is always the issue, that public scrutiny is so useful for organisations, providers and commissioners, and it should be valued for the understanding that people will take away from that message. Thank you.
Absolutely, yeah.
Are there any more questions or points at all from members?
If I could just add that we have a website and there's a lot of information on the website. We're always available on telephone, email. We're at North End HUK Portsmouth offices. So please spread the word about Healthwatch. And yes, we are busy bunnies.
Right. Thank you, Siobhan. Thanks for your report, and
You're welcome.
It's noted.
Thank you.
So
I've been told I'm allowed to crack on now as well.
You are. I
Thank
hope your voice holds up.
Thanks. Bye-bye.
Okay, bye-bye. Thank you. So next we'll go on to agenda item 7, Southern Health Update. So we've got Nikki Crichton-Young. Nikki, could you give us a brief summary of your report, and then members will ask you questions?
Yes, absolutely. Thank you, Chair. So the report is broken down into 2 parts. The first aspect gives an overview from Southern Health in terms of the key updates and the particular aspects that are relevant to share today, recognising that I think our last updated report was produced in March, are in relation to the work that's going on through Project Fusion. I'm sure colleagues on the call will be reminded through the various stakeholder letters, etc., that you will receive, that Project Fusion is the name currently that we're using to create the new combined NHS Foundation Trust across community mental health services and learning disabilities, Hampshire, Isle of Wight wide. And just to kind of remind people in terms of the purpose of that is the focus on bringing together the organisation so that we address some of the unwarranted variation that goes on across the geography of Hampshire, Isle of Wight, and look at how we can strengthen and take forward the skills of our workforce in an integrated way, and not dissimilar to some of what you heard from Portsmouth Hospital colleagues and the integration work on the Isle of Wight. It's to strengthen the leadership structure and to also look at the efficiencies that can be driven forward in terms of consistency of approach, particularly around some of the corporate functions, etc. We're in a position at the moment where the detailed full business case is being worked through. That will go to the respective boards in October and NHS England for final review, with the position as it stands to go live with the new organisation by April 2024. As part of the process with regards to that, we've undertaken the appointment of the chair of the new organisation, which is Lynn Hunt, and the chief executive has been appointed, which is Ron Shields. They're now in the process of undertaking the recruitment of the executive team as a whole, so that will start to run in shadow form, hopefully at the latter part of this year, in readiness to go live as an organisation, single entity by April next year. The other aspect I probably want to bring your attention to is the lifting of the enforcement action, which happened in April 2023. This was a really positive position for us as a trust, recognising some of the historical challenges that have been had, particularly around our mental health services, and a recognition of the important steps that we're taking as an organisation to move forward with some of those improvements. To link to that information, just an update for you around our mental health acute and crisis pathway and work that we're doing in Southern Health currently to strengthen the leadership and drive forward with the improvements, is meaning that we are looking at how we currently deliver those services, so we do some of this at scale. Part of the challenge, I think, to be said, is having some of that clinical leadership to the extent that we need to in all parts of Hampshire. So how do we bring the right expertise together to focus on those right improvement pathways? Part of that work is very understandably linked into, and I'm sure everybody will have read quite a lot in the media around suicide prevention, and as a trust we're leading on the suicide prevention work alongside our colleagues from the City Council and Portsmouth City Council and Hampshire County Council, as well as the wider voluntary sector. It's really encouraging, I think, and I'm sure everybody would recognise that the ability for Portsmouth Guildhall to be lit up in orange on Sunday the 10th. So, thank you for that. I think that was a really positive statement to mark World Mental Health Day as well. We've recently undertaken our annual members meeting, and it was done virtually, but we had over 100 people attending that meeting, which was a really positive position as well, and that there was lots of views, as we understand, from the public around what's happening at the moment with Project Fusion. Robin Harlow presented an update with regards to primary care. And that's available online, of course, for people to be able to review and see, and I'm sure some of you attended. Then specifically the second part into the Portsmouth and South East Hampshire system of Southern Health. We're continuing to work with partners and colleagues in PHU and Solent around the winter planning. Not dissimilar to what Mark has already shared in terms of the work he's now undertaken across the trust of the programmes to support our staff and our patients and residents in relation to having flu vaccinations, COVID vaccinations, etc. I think it's important to note that we are seeing as a system some real pressures in light of the financial challenges across the wider ICB, but we're all working collectively together to look at how we ensure sustainable services are delivered, and part of the work of the programme Fusion and the joining together of the organisations is to ensure that we're doing that and that we're wisely spending every pound as we know. And, as again, I think Mark referenced earlier on, that the very nature that we are not as efficient as we were pre-COVID. So that's clearly an area of focus for us all. I'm aware I presented to you last time quite a lot of detail around frailty and urgent response. I wasn't going to go into that in any more detail today, unless there's anything specific. The other elements are then of note, the merger that has happened with Gosport Medical Centre and Willow Group. That successfully merged on the 1st of April. I know that there's been an opportunity for our patients and public to come to a number of events and get some assurance with regards to that merger and what that means. but just to assure really that that is running as a process now smoothly, and we're continuing to learn across both Willow Group and Gosport Medical Centre and supporting each other in terms of how we do that. So that's really positive. I think the other aspect to say is the priorities that we're focusing on around our mental health services, particularly the eating disorder services, and some of the challenges that we know they are nationally at the moment for our patients with eating disorder services, which do remain a concern for us. The work across at the moment with the Hampshire Isle of Wight ICB around how we address some of those eating disorder services and support those patients, particularly in terms of when they need residential care, it is an ongoing programme of work, and I'm happy to bring some more of those updates later on if that's helpful. They're probably the key aspects I would share today.
Thank you, Nikki.
Open to any questions?
Thank you, Nikki. I'm going to go over to members for questions. I've got Councillor Judith Smythe.
Thank you, Chair. Portsmouth had a very particular, strongly developed integrated service. Not talking about integrated commissioning, although that was part of the reason it worked. But are there, I know a number of people who are involved in setting up those integrated services over the last 20 years or so were worried that when you and Solent were talking about merging, and indeed the integrated commissioning came in, that a lot of the work that showed very, very good outcomes, because it was integrated and often preventative work, particularly around mental health or around keeping people in their own homes and that sort of thing. Have you got any examples where that integrated work with the City Council, both adult and children's services, has been dismantled because of what is happening to you and happening to commissioning?
Thank you, Councillor Smythe. No is the answer. We haven't. What we are continuing to do and work with the ICBs at place is to understand and recognise the importance of place, Portsmouth being a place in its own right. In terms of the work that Solent and the Portsmouth City Council have been doing and working together as an organisation, there is no intention to not recognise the value that that's had in the new organisation going forward, and there is therefore no plans that I'm aware of at this stage or have been in discussion in any way to do anything but strengthen that, take learning from some of that across the wider Hampshire place, certainly not to dismantle the work that's already been happening. And Joe may want to come in and comment on that as the place director as well for the ICB.
Okay, thank you. Can I ask Joe? I think you've put your hand up at the same time, so that's brilliant.
Yeah, I'd like to echo what Nikki has said. I think we're all, I think Judy's right, there have been concerns around that from lots of the teams in the city, but as Nikki said, we're working really closely with Fusion and the ICB to really look at how we strengthen integration across the board and learn from where it's working well. I think the way we've always worked on Portsmouth, if we can do it better and learn from others as well, then we will, but it would absolutely be within that bedrock and foundation of that integrated provision. So as Nikki says, it's about how we strengthen that and share across a wider footprint as well.
Thank you. I know Councillor Judith Smythe, you put your hand up, but actually just picked first. So did you want to come back at all?
Yes, please. I mean, I'm delighted to hear that, and I hope you're measuring the success of services by outcomes, not by some idea of how it should work consistently. You mentioned consistency and efficiency twice in your presentation, without, I think, looking at outcomes and the different needs of different communities, particularly, for example, in Southampton and Portsmouth ethnic communities. The additional poverty in both those communities come to mind. And I'd just like to wish you good luck. You need to keep reminding yourself although I know everybody's trying to forget, that Connor Sparrowhawk died when we in Southern Health took over services in the North Hampshire and South Oxfordshire. And it is extremely difficult to merge cultures and keep risk to patients down. And it's very necessary in community health services to recognise that it's uniformity of results, including safety and risk, that you need to achieve, rather than uniformity for matters of efficiency and imposed ideas of models that may work somewhere and may not. So I wish you good luck.
Thank you, Councillor Smythe, and I hear exactly what you're saying in relation to my reference to the efficiencies. A lot of that is in terms of the back office functions, and you're absolutely right. What we need to remain focused on, and we are remaining focused on as individual trusts, and as we come together, and all of the business case and the focus of the business case is all around clinical strategy and outcomes. This is about doing what's right for patients, local populations, and meeting that need. So thank you.
Thank you. I've got Councillor David Evans next, please.
Thank you. Thank you very much, Chairman. I would fully endorse the comment that Councillor Smythe has made about outcomes. Absolutely crucial. Now, I have a question. My background is in the private sector, in manufacturing. I've done lots of business cases for lots of projects, and they are always conducted before you start spending money. That's the purpose of doing a business case. What I'm puzzled, I've got obviously a lot to learn about how the health service operates. What I'm puzzled about is the section where you say recent progress, and you've made 2 appointments as chief executive and chair, and now you're carrying out a full business case study. I think a layman would say you're putting the cart before the horse. You haven't. Your business case should justify the hiring of people, shouldn't it? Or is that not how the health service works? I'm sorry. Thank you.
Thank you, Councillor Evans. Just for clarity, it's the sign-off of the final business case in March. The preliminary business case that has allowed us to progress the recruitment and appointment of the chief exec and the chair has already gone through approval through NHS England. So it's about the processes that have happened, and the sign-off of the full business case then. Of course, whilst those appointments have happened, they do not go live until such point as the actual new organisation commences. So at any point, if that, there was a pause or any adjustment in that process, that could undo those such appointments anyway. So just to give you that assurance.
Thank you. It's the way it was presented on the page. It just read funny. Thank you very much.
Yeah, I appreciate that. Apologies for that. Thank you.
Thank you. Members, are there any more questions? No, I don't think so. So in that case, Nikki, thank you very much for your report. It's noted. You're welcome to stay if you want, but equally, if you need to leave, we understand.
Thank you.
Okay, so the next agenda item is agenda item 8, access to primary care. So Jo York, please. Jo, could you give a brief summary of your report, and then members will ask questions?
Yeah, of course. So this report provides some more detail at members' request in relation to access to primary care and primary care appointments. Provides quite a bit of detail on that to show how that how appointments are offered in the city and how that compares. What you will see within that is quite a considerable amount of variation, and that is because this data set is relatively new, and it's really beneficial that we have it. However, it does underlie the fact that each individual practice has a different way of working, and therefore counting it is not always the same. So it's hard to compare apples and apples. And apples and pears, really. So we just need to take that into consideration when we review this data. But having said that, it does start to give us a much better view around trends, and looking to see that variation and where we fall against, you know, other areas nationally. So more information on that, but again, some caveats with how much we can interpret into that. Provides details of the delivery plan for improving access to primary care, which is a national plan which came out in May 2023 and is being developed with PCNs and practices, and a report due to go to the ICB board in November. But the report highlights some of the trends that we're sort of seeing in areas where our local practices are working on, and that includes things like their telephony, although they are all now on the cloud-based telephony. It's how we make optimum use of that and understand what that's telling us about demand, updating their websites, and use of e-consults as well as further engagement with patients. The report also provides some details on further. Oh, sorry. Bear with me 2 seconds.
Am I supposed to sing now or do some music, you know? You wouldn't want that. Were you volunteering then, Councillor Smythe? No, you're not going to get it from me either.
While we're waiting, Chair, I'm just going to go off camera for a couple of minutes.
Okay.
I do apologise, Councillor. I had to have a builder in and they just started drilling and it was really noisy, so I was concerned you wouldn't be able to hear me. So I do apologise. Yeah, so the report also provides some detail on estates, changes in the city, a further update on the Highclere site, and oh gosh, I've forgotten the name. The Bransbury Park, which has been approved and we're working with the council on, as well as information on dentistry and some of the concerns and challenges I know you have in relation to that and the work we've been doing locally to try and improve the position, as well as an update on community pharmacy, and also the roundtable discussions that we're doing with the City Council and leader Councillor Matthew Winnington to look at how we can work together to support community pharmacies in the city. Thank you. Apologies.
Thank you, Jo. So I'm going to open up to members. Do members have any questions from this report? No. Okay. So thank you, Jo. That report's noted. And we'll move on to the next agenda item. Councillor Graham Heaney.
Sorry, I was looking at the report while you were saying, and I was a bit slow. I just had a couple of questions actually. When we discussed in the council the provision of GP services, the council has in the past offered support around things like buildings or support for back office services to help help practices to manage their staffing. Has any of that been of any real use or taken up practically at all, or has it not been feasible to do that or to make use of those offers?
I think it's quite challenging in terms of some of the back office functions, but certainly where we have seen real benefit from the council's support is in relation to our integrated teams. So the integrated intermediate care teams that we have, the integrated mental health and learning disability teams, but also what we're really exploring now is the work with public health and population health management. So there's lots of support that's going into practices from the public health team and supporting that community and practice engagement. So the work that we're doing with the council, public health and our Health and Care Portsmouth comms team around both Paulsgrove and Portsea to look at health needs and how people are accessing healthcare in those areas. So it's in those areas where I think that partnership working with the council is at its strongest, but also in developments such as Bransbury Park as well, and how we're supporting, working together on that.
Yeah, thanks.
Okay, thank you very much. Councillor Judith Smythe. You're on mute.
Is Bransbury Park going to be for an ordinary GP practice, or are the moves to set up salaried GPs probably under the trust, as with the Gosport pilot really across Hampshire? I think that there are a lot of young GPs who don't want to be bothered with dealing with the gutters in Victorian buildings that are used for surgeries. That's to exaggerate the case a bit. I know a lot of them moved. So are there any proposals to increase recruitment to GP posts in Portsmouth through setting up a salaried GP practice? That's the first question. And the second one is access to the GP still comes up on the doorstep all the time. And I think there needs to be a little bit more publicity given to what the statistics actually are, in order to improve public confidence in being able to get an appointment with the GP. So there's two questions there.
Yeah, thank you. So Bransbury Park, apologies if it's not clear in the report, but Bransbury Park, it will be for an existing GP practice, the Lighthouse Group practice. Can you still hear me okay?
It's perfect, yeah.
All right, thank you.
Yes, I can hear you, and thank you for that. I thought that was the case, but I wonder if there have been further discussions about setting up a salaried GP set up possibly at Bransbury Park. No,
it's for the GP practice. What we are doing with Portsmouth Primary Care Alliance is working on attracting newly qualified GPs into the city to work in a range of areas, again to strengthen recruitment into the city, and that's been quite, touch wood, early days, but looks quite successful. And some of our practices are starting to attract more GP partners into the city, so we seem to, again, touching everything, having an upturn in recruitment into the city, so that's good news. Absolutely take your point though, Councillor Smythe. There probably is more we can do to really show and demonstrate the access in the city, and to try and show where there are strengths. So we're looking at that as well. Thank you.
Okay, thank you very much. Councillor Matthew Atkins, please.
Hi, Joe. Thanks for the report. Positive news about the Highclere site in the report, getting all the sign-offs it needs now. I was just wondering if there was anything more news on Cosham Health Centre, what is carrying on there, what isn't carrying on there, when the whole thing is shutting down in its entirety to be demolished, kind of thing, if there's any further news on that. And is it true that, is there still a small amount of GP appointments being provided there by Drayton, is that right, or in a separate smaller building, or have they stopped doing that now?
So the Drayton practice have a branch surgery in Wootton Street, which is very close to Cosham Health Surgery, Cosham Health Centre, but not in the building. So they will continue to offer appointments in Wootton Street, and we did some internal refurbishment with them to create a bit of additional space until Highclere is completed. So that will continue. Cosham Health Centre, to my understanding, it is there is I don't think there's anything being provided through there. There was some podiatry which provided by Solent NHS Trust, which has moved off site onto Jubilee House, but there was very little else. So my understanding is it's not being utilised. In terms of sale of site, etc., I would need to go away and find out more about that. It's owned by NHS Property Services, the building.
Sure. If you do get any update on that, I would obviously like to keep up to date with what's happening with that building. Is North Harbour now completely gone and all their patients moved, or is there? Yeah, so that's completely.
No, that all the patients were transferred, and as Siobhan said, Healthwatch are doing a piece of sort of work just to see how that transfer went, and both of the two practices that took on the vast majority of the patients, so Portsdown and Drayton, and Drayton Surgery are also doing some work with those patients. In the main, it seems to have been a positive move, and patients are, continue to experience good quality care. But we are looking to review continually as well.
Great, thanks for the update.
Thank you.
Thank you. Members, are there any more questions on this agenda item? No, I think that's a no. So thank you very much, Joe. The report's noted. And we'll go on to the next agenda item, which involves you as well. So it's agenda item. Let's have a look. Agenda item 9, the ICB Recovery Support Programme. So, Joe, could you give us a brief summary of your report, and then members will have questions?
Yeah, so this report just provides an update to the committee around the fact that, given the significant financial challenges that we have across Hampshire and the Isle of Wight, the need for partner organisations, and in particular the ICB, to have had to go through and be part of with NHS England, the National Recovery Support Programme, which really works to provide us assistance and to monitor the financial challenges that we've got, and really that support provides us with an experienced system improvement director who's worked with other NHS organisations who faced similar challenges, and it helps us to embed further improvements by addressing the underlying drivers of the problem. And again, it recognises the significant deficit that the ICB is in, and really the monitoring and the work to pull that back, really. So it really just sets out in more detail for HOSP some of the drivers around that, including some of the challenges we've had across the system around post-COVID in managing people with non-criteria to reside in acute hospitals. The industrial action has contributed, unfortunately, the backlogs around elective and which reduces elective activity, and therefore the incomes trust can generate, but also pressures regarding pay awards. Some savings haven't yet been delivered as planned, and we continue to work through how we're making those savings, particularly in prescribing costs and continuing healthcare. That's across Hampshire and the Isle of Wight.
Thank you, Joe. I'm going to open up questions to members, but first, if people could, if members could indulge me, I'd like to just make a quick sort of comment on this. It's actually obviously the full NHS Hampshire and Isle of Wight ICB reports, but Joe, you just cover an area of that in your role for ICB, don't you?
Yes, I take responsibility for some areas across Hampshire and the Isle of Wight, and I'm part of the Hampshire and Isle of Wight executive management team. But yeah, predominantly my role is around Portsmouth.
Okay, thank you. Thanks for confirming that. Members, do you have any questions at all? Councillor Graham Heaney.
Thank you, Mark. Thank you, Joe. Thank you for the update. In the report, it says that 4 months into the financial year, the deficit is 107 million. Do you have any feeling for what an estimate of the potential full year deficit might be?
I mean, it's always a bit of a moving feast, but really where we need to get to is with 5.8 million per month off plan. So it's 5.8 million each month that we need to save to bring us back on track with the plan that was agreed with NHS England. Does that make sense? So it's
really from now until.
Sorry,
Councillor Heaney, you're on mute.
Sorry, it went. So sorry, you're saying that from this month onwards, every single month until the end of the financial year, you have to find £5.8 million worth of savings. Is that correct?
Yeah, so each month we spend £5.8 million more than we get in. It's not cumulative 5.8 million. Well, I suppose it would be, wouldn't it, if you don't bring it back in? But yeah, right. we're spending £5 million more than we have each month, and that's the saving plan, is to bring that run rate back on track and to reduce that.
Thank you.
There has to be an implication for services, surely. And what are the implications for services of having to do this? That might be a long answer, but I'm thinking, is there any way we can find out more about what the implications are for services for this?
Yeah, I mean, so particularly in some of the Hampshire areas, they have had to look at the out-of-hospital services that were funded during COVID through what was then the hospital discharge pot, and some of those services had continued, but again they'd continued at a rate that wasn't affordable. So some of those changes, and indeed that went to the Hampshire HASC earlier this week around the reduction in provision that would have to take place through that. For Portsmouth specifically, the hospital discharge programme, we managed that back in 2021, 2022 with the work that we did to sort of co-locate services on the Harry Sopnick site and the opening of the Jubilee unit. So if you remember, prior to that we had the Victory service and Jubilee, but based up in Cosham. We then put them together on the south. We then closed Victory and put it on the Southsea site, and then we moved Jubilee in and created that integrated offer. So that's how we managed it in the city to bring that back in budget. So that hasn't impacted us here in the same way. There are also significant challenges around prescribing, but again that's sort of a national issue, but we're working to make sure that we don't cut services to patients, and actually we're working with our GPs to make sure that they're prescribing those drugs that are on the foundry that provide best value. There are some challenges in continuing healthcare, particularly in the Hampshire area, and again looking at how we better manage those reviews and are offering more timely services to people. So one way. So really what we're conscious of is there is lots of variation when you look across Hampshire and the Isle of Wight, and that means we're often double paying for things or paying twice, or have variation in what we pay. So a lot of the work has been around reducing that variation and creating some consistency in how we fund things.
Councillor Healy, did you want to come back at all on that for the moment?
Yeah, and presumably we'll be getting some updates on what's happening with this deficit and how it's being managed, etc., as we go through the rest of the year. Yeah, you'll be coming back to that. Yeah. And obviously it's a system-wide issue because we are now Hampshire-wide, but obviously I have a particular interest in Portsmouth and what the impact is in Portsmouth. But I'm obviously interested as well as what's happening elsewhere, because that potentially has knock-on impacts too. So yeah, I will obviously be wanting to continue to see what the impact of it is and what the progress is on dealing with that financial situation. So thanks for that.
Of course, and any for any services that do have to close or stop as a result of this, we would have to do an internal quality impact assessment, and there's a process for that both within the ICB and across the ICS. But also we would need to bring, any formal changes to service would have to go through HASC and HOSP and the consultation process as well. So we have that route as well. But at the moment, it's certainly for us in Portsmouth, it's more about making sure we're streamlining processes, bringing our prescribing budgets online, and creating good management of our continuing healthcare and extra contractual referral budgets as well.
I have a slight issue, I guess, in terms of accountability, because the Hampshire and Isle of Wight NHS Trust covers the whole of the area, but you're you've got an interest, I suppose, more in the Portsmouth area. And for something this serious, I wondered whether we ought to be asking a member of the board to come and give a report back, because actually a 2-page report on one of the biggest deficits in the country, if not the biggest deficit in the country, it doesn't seem that us as an accountable body is being given much information. That's my personal as a personal view as an individual on this.
Yeah, I think the same information has gone to all of the overview and scrutiny committees and stakeholders. But yes, I completely take your point. And as we get into this more, then you would, of course, understandably want to have more information. So really happy to feed that back and ask for a member of the executive team to come to the next overview and scrutiny committee.
Thank you, Jo.
No worries.
Any other questions from members at all? I think that's no. So thank you very much, Jo, for that report.
Thank you.
It's noted.
Thank
and yes, if you could do that, that would be great.
Yeah,
so that was that. Thank you. So that was the last item on the agenda today. So I wanted to thank members. The next meeting is scheduled for 23rd of November at 1:30. So I will officially close the meeting and ask Lisa to stop the live stream. Thank you.
Thank you, Chair. I'll let you know when we're offline.